back in your morning wake up. Medical issues here. We've had some discussion before about, and I don't want to go too far afield, but yeah, why not? We do it. It's talk radio. But we've had discussion before about medical schools in the United States, how difficult they've been for folks to get into. That's caused some problems. They're hard to get into. They're expensive as all get out. To get through, I mean, you pretty much have to take out, you'll get loans, but you're going to be paying the back. You're well equipped in some respects to do so. But has that suppressed the number of young docs coming out? And what about those who do come out of medical school? Are they prepared to be primary care doctors? Are they prepared to go to maybe places that aren't the sexiest communities in America? Just being honest. Some of our rural places in Michigan, there are incentives to get doctors in there, but more often than not, we're looking overseas now in a lot of different ways. What if we get to the point where there's such a shortage on primary care docs that the actual care of patients, flat out, whatever medical insurance or coverage plan you're under, is threatened? Is this a valid point to make? Let's talk about it this morning with Dr. James Pickney. Dr. James, founder and CEO of Diamond Physicians in Big D, Dallas. Good morning. Welcome back.
Hey, good morning.
So is it a fair assessment to make? Is it a fair question to ask? Are we going to be in trouble down the road, or are there ways to address this in the short term and long term to alleviate the problem?
Well, currently we have a huge problem on our hands. We are short in the next 8 years about 50,000 docs, and that number could balloon to 104,000 in the next 12 years. And to put that in perspective, there's about 220,000 primary care physicians currently. So if we're short about 45% in the next 12 years, that's a huge problem for the population, for population health. Now, what can we do in the short term? There's a lot of new innovative models out there that we talked about before. There's membership medicine. Direct primary care is gaining momentum in Michigan. Your senator is on board with this new healthcare delivery model. And I think telehealth is going to play a huge role as well, especially with rural populations that don't necessarily have a DPC clinic or a doctor within a 30-mile radius. So there's a lot of innovation out there that's also going to incentivize medical students to go into primary care, because right now primary care is not glamorous. It doesn't pay well compared to other specialties. So we have to do something to reinvigorate primary care and make sure that we have medical students that continue to want to become family medicine physicians.
Do they need to make like Doc Hollywood 2, 3, and 4 and do some kind of like marketing that way? You remember those films? I mean, that kind of brought it home, didn't it? That there was, it was a stereotype and a caricature, but there was some truth to it.
Absolutely. I personally, at Diamond, I mentor medical students, and I let the residents rotate with me to expose them to new innovative models. Our physicians make almost twice as much as the average family medicine physician. They have more quality time with their families, and they have more quality time with their patients, and that's the most important thing. So there's models out there that reinvigorate that patient-physician relationship, allow for 45-minute visits instead of 7-minute visits. And there's one particular product out there called Dr. Link that is a brand new telehealth product that doesn't do the fee-for-service traditional telemedicine model. So it's not a 1-800 number with a queue. You get the same doctor every time. So it's pretty much like direct primary care, but no in-person visits. It's fantastic. So there are companies out there that are moving the needle forward and really revolutionizing the industry. And I believe in the next 2 or 3 years, you're going to see even more innovation, more than Dr. Link, more than direct primary care. So I'm very excited about the future. Dr.
James, I want to ask you about that because, look, I have a friend who told me recently, and I discussed some of our segments that we've had in the past, and I said, going to these non-in-person, but, almost like you're Skyping and you're doing a visit, and there's different ways to get really up close and personal, as doctors like to do, with their patients because they have to. But he said, he said it wouldn't bother me because my primary care, when I'm able to get in, never looks up from his iPad anyway. I thought that was a rather telling statement and not a good one for bedside manner, is it?
No, and unfortunately in the insurance model, the doctor on average has about 7 minutes to get the visit done. So that's why they don't look up. Direct primary care is completely different. You're going to have face-to-face, eye-to-eye contact. You're going to sit, talk, establish rapport, have at least a 30-minute visit. Sometimes in my clinic, an hour visit is very common. So that's just unfortunate that he had that experience, but that is the norm for the traditional insurance model. And in virtual visits, we have a HIPAA-compliant, secure platform where you can FaceTime and you can text and email chat. So these are great new modalities that aren't substitutes for in your annual physical, but can definitely supplement your primary care experience. And like I said before, in the rural areas, this might be the only option for some patients.
Have Dr. James, before we let you go, has there been, in your mind, with medical schools here in the United States, look, they want to be seen as selective. They want to be seen as the best. I get that. You get more donations. Maybe you get a higher quality coming out the door. But have they been too selective and slammed the door on some potential great students and thus help make some of the shortage themselves?
Well, I think the entire education industry, the standards have gone through the roof. So if you look at SAT scores 10 years ago, even I went to Wake Forest, and now the average SAT score, I think, is 25% higher than it was when I went there. Medical schools are the same way. Your MCAT scores are going through the roof. The requirements are very stringent. I don't know if they need to loosen the requirements, but they need to do something, either enroll more students or open more medical schools. But we want the best and the brightest going to medical school. But at the same time, you don't want to turn someone away because they don't have the greatest test scores, because test scores don't tell the whole picture.
Right.
They don't tell someone's heart, their work ethic, their compassion for patients. There's no score for those things. So I think maybe if you add more factors into the mix, don't just focus on scores as much, increase the number of students enrolling, and try our best to open new medical schools. There's one opening in Austin here in Texas shortly. That's going to be the key to producing more physicians and ultimately more primary care doctors to prevent this shortage.
Dr. James Pickney, the second founder, CEO, Diamond Physicians. He's Dr. James. Where do we find you online, as always?
You can go to diamondphysicians.com, follow me at _Dr. James, and Dr. Link is a phenomenal platform, thedrlink.com.
Good stuff. Appreciate the visit. As always, thanks for being here.
Thanks for having me on.